there. My next guest is a Republican congressman and a doctor who has actually administered some COVID shots to help reluctant people get on board. Congressman Brad Wenstrup is with us. Thanks for being here, Congressman.
My pleasure, Victor. Thank you for having me.
Let's start here with the numbers and the important question of why. Let's put up the Monmouth poll. When asked if people plan to get vaccinated, 43% of Republican respondents say that they will likely never get vaccinated, compared to 22% of independents, 5% of Democrats. The basic question, why are so many Republicans reluctant or refusing the vaccines?
Well, that's a good question, and so that's one of the things that we engaged in. I was on a event with Frank Luntz, who you may be familiar with, and he had people on this call that were Trump supporters but were hesitant to take the vaccine. And it was interesting because as we sat and I was talking as a doctor as opposed to a member of Congress, we explained how Operation Warp Speed worked, how we weren't cutting corners, we were cutting out some of the bureaucracy, and that actually more people took part in these trials than normally are in trials before something's approved, and just to explain some of the science. And one of the takeaways that we got from these people said, you know, I'm more inclined now. Most people said they were more inclined now after they listened to doctors and also listened to Chris Christie was on the call, who got very sick from COVID, and they understood more the risk of COVID. And at the end, they said, I'm more inclined now. We just want to be educated more, not indoctrinated. And as you know, politics has unfortunately played a big part in this. As a doctor, I really wish it was not. There's been a lot of things about this virus that we thought was going to happen, didn't happen. Yeah, go ahead.
I watched that focus group, and you had some people who went from 80% against it to maybe half and half, and there were some people said I was a zero, and I'm still a zero. But Democrats trust their doctors too. I mean, they also talked about their spouses. Independents talk to their spouses. There's something unique in these numbers consistently that Republicans are more reluctant. So have you gotten to what that element is?
No, not exactly. But I do go back to, the idea of talking to your doctor. That's what we want people to do. Talk to your doctor, get the information. Yeah. There's a lot of people that don't trust government, and I've always made this case. But it's interesting of who you trust. I'll give you an example. You said I've now given shots, and I've done it with the National Guard and in uniform, and I've done it just on my own. And I have both urban and rural. And we had folks from a retirement community where we went on the bus, got their history, did all the paperwork, and then gave them their vaccine. Yeah. And I go in uniform. The lady sees my name, and she says, "Can I get a selfie with you?" And I said, "Sure." And then I gave her the shot, and she said, I probably don't agree with you on one thing politically, but I'm very grateful for your service and for you here giving me this shot today. So the mindset it's different for a lot of people, and it's a trust factor, I think, that weighs with a lot of people.
Let me ask you this, because in the question of leadership and trying to convince people, as you are, to get vaccinated, Republican Senator of Wisconsin, Ron Johnson, was on a radio show today and talked about the vaccine, and this is what he said. The science tells us that vaccines are 95% effective, so if you have a vaccine, quite honestly, what do you care if your neighbor has one or not? I mean, what is it to you? You got a vaccine, and science is telling you it's very, very effective, so why is this big push to make sure everybody gets a vaccine? He asks that rhetorically. I'm going to ask it directly. What's it to you that your neighbor gets vaccinated?
I think public health. I mean, I think that's the important thing is what's going on in America. And don't we all want to get back to being open? I don't want to force people into taking a vaccine, but I want them to get all the tools that they need to understand why it's important.
And what's the impact of statements like that from members of Congress when you're trying to get people vaccinated and Ron Johnson is saying, essentially, get your vaccine and mind your business?
Well, again, I think it all comes back to educating people on the importance of public health. I served on our board of health.
Educating your colleagues?
We didn't have any... What's that?
Educating your colleagues?
Well, that's what we are trying to do as a doctor's caucus, is educating everyone on the importance of this from a public health standpoint. And, it's across the board. Anecdotally, as I've been out and about, I can't necessarily tell if anyone's Republican or Democrat, and I'm sure
Yeah.
not going to ask in a situation where I'm there as a medical provider, right?
Congressman,
So the
look,
polls are interesting and obviously of concern, and
but
that's
they're
why we
also
did the.
consistent. They're also consistent in showing these high percentages of Republicans who are reluctant to get it. Listen, I've got to get to one more thing before we go. You are the co-chair of the GOP Doctors Caucus. 18 doctors. You signed on to this letter, sent it to the Speaker of the House to lift the COVID restrictions in the House. Most of them, you didn't say all of them. The letter demands that, quote, this era of higher hygiene pretense must end. Why is now the time to lift restrictions when the public health experts in this administration and in Congress are saying that this is not the time?
Well, some of them are saying that it is the time. The CDC has said that if you're vaccinated, you can gather together in these types of groups, keep your distance. But it just hasn't been
Congressman,
very functional.
that's not what the CDC says. The CDC says that unvaccinated people, vaccinated people rather, can be with other vaccinated people without masks, without distancing. Right. But also that if there are unvaccinated people from multiple households, that you should still distance, wear masks, and take all the precautions. You don't have all vaccinated people in the chamber or their staffs, right?
Right. And so, Victor, you hit the nail on the head. I look at Congress as a body, and a decision was made to prioritize members of Congress to get the vaccine. And quite frankly, there were some people, so as a doctor and as a soldier, I needed to get it. But there were a lot of people that took the approach as like, look, I'm not as vulnerable. I want that vaccine going to somebody elderly or with comorbidities, and I want to wait. And I understand that. I think that's honorable. But we were given the opportunity to get the vaccine. And what we don't know is how many people actually have and have not.
And if you don't know that, then why is now the time to lift the restrictions?
Well, because we should know that. And
but
we
you don't.
Should be able to know.
I know that. But shouldn't you know that before you ask? If you can now get together in small offices and stop the social distancing, it seems like it's in the wrong order. The caucus sent a letter to the Speaker of the House saying lift the restrictions, and you don't know how many people are vaccinated.
I appreciate that, but if you look at the intent of the letter, one of the things that we asked was, what are things that we can do as physicians to aid you in this process so that we can get back to being a more functional body? And that's what we asked. It was a very respectful letter. And we were asking, because we got the opportunity to be vaccinated, and some of the restrictions for vaccinated people have been lifted, should we be taking a look? It's not demanding anything per se. It's asking, what more can we do to try and get us back to be a more functional body? Because I think you will find on both sides of the aisle that all agree, the more that we can interact with each other in person, the better off that we are, and the more we can function cohesively like we have in the past. That was the intent of the letter. So you're right when you say we don't know, and I would like to know. Now, there are HIPAA rules, so that people don't have to say whether they've been vaccinated or not.
Certainly is.
But can we put guidelines in that if you've not been vaccinated, what precautions you should be taking as a member of Congress, and if you've been vaccinated, what liberties you can have? It's a very common sense thing, and it wasn't intended snarky or partisan.
We will see what the response is. Congressman Brad Wenstrup, thank you so much for your time, sir.
You bet. Thank you. You have a good day.
You too.
Those are great questions for him. I mean, he obviously has his work cut out for him in terms of getting more people on board.
Yeah.
But as he says, he's trying.
And starting with some of his colleagues. Listen, he is going out, administering some of the vaccines, trying to convince people back home in Ohio. But as we heard from Ron Johnson, he may have some people to convince across the hall.
Indeed.
Yep.